Dear children, do you know that one of the basic duties of our government is to look after the health and general well-being of the citizens?
Public health is about helping people to stay healthy and protecting them from threats to their health. The government is supposed to provide us with our basic needs like clean drinking water, minimum food, proper sanitation, education and medical facilities regardless of our social status. One driver of growth in the healthcare sector is India's booming population, currently 1.1 billion and increasing at a 2% annual rate. By 2030, India is expected to beat China as the world's most populous nation. Healthcare is one of India's largest sectors in terms of revenue and employment, and it is expanding rapidly. During the 1990s, Indian healthcare grew at an annual rate of 16%. The private sector accounts for more than 80% of total healthcare spending in India. The quality of Indian healthcare is varied. In major urban areas, healthcare is of adequate quality, approaching and occasionally meeting Western standards. However, access to quality medical care is limited or unavailable in most rural areas. When a patient goes to show himself in a rural governmental hospital, he has to face the long queues to meet the doctor. Once he gets to meet the doctor, he has to again stand in a long queue to get the medicines. That is quite tough. Whereas in private hospitals, you can meet the doctor in just a few minutes. If there is an emergency, you can show him immediately by paying some more money. The medicines and other facilities are also made available to you quickly.
However, there is a big difference in the rates of the public and private hospital. What you can get done for free in government hospitals, you have to pay thousands of rupees to get it done in a private hospital. India has a universal healthcare system run by the constituent states and territories of India. The Constitution charges every state with raising the level of nutrition and the standard of its people and the improvement of public health as among its primary duties.
The National Health Policy was endorsed by the Parliament of India in 1983 and updated in 2002. The National Rural Health Mission is especially targeted at providing medical health care facilities to the people who reside in rural areas. At the village level, there is an ASHA worker who helps people in getting medical services. The Anganwadi centers provide basic nutrition and immunization facilities to the children. Regular medical checkups are also done.
The sub-centers have trained multi-purpose health assistants who help the people in getting medical services and take care of their health. These centers cover a population of 5,000 people.
These centers work under the supervision of PHC or Public Health Centers at the Mandal level. These centers take care of a population of 30,000 people. For every 4 or 5 PHCs, there is a community healthcare center. CHC has around 30 beds and some specialist doctors. At the divisional level, there is an area hospital with 100 beds. At the district level, there is a district hospital. In big cities like Hyderabad, they may have many government hospitals.
Their services are known as public for many reasons. The government fulfills its duty towards the general public by taking care of them.
Government tries to look after the general public and provide medical treatment either free of cost or at low rates so that even the poor people can also avail health facilities. For this purpose, the taxes are charged from everyone. The tax money that is collected is used to maintain sanitation in the country, to treat and prevent the outbreak of any dangerous diseases, etc.
Well, as the name suggests, the private healthcare facilities are now owned by the government. They are easily accessible but are expensive. So these facilities are mostly availed by the rich section of the society. These include a host of modern and highly advanced medical services for a variety of ailments.
There are many health insurance companies that provide health insurance to people. Insurance against loss by illness or bodily injury. Health insurance provides coverage for medicine, visits to the doctor or emergency room, hospital stays, and other medical expenses.
Health insurance can be directly purchased by an individual or it may be provided through an employer. There are many health insurance policies and programs which provide health insurance to elderly, disabled or uninsured individuals. Dear children, we discussed about the private medical services. They are only affordable by the rich. So what does it mean? Should the poor people be left unattended? Have they no right to get medical treatment? No. Just to ensure that every section of our society gets basic medical facilities, our government has set up services like 108, the emergency ambulance number, and 104 to get free consultation and health tips by the doctors. But remember, never dial these numbers for fun. There must be someone needy trying these numbers, and if the line is busy, he will have to wait unnecessarily. This is simple. Tell me, what are your basic needs? What do you basically want from the government? All of us want electricity, clean water to drink, sanitation in and around the area where we live, and basic medical facilities, right? These are all known as basic public services.
The government here has an important role in providing all these facilities to us. Not only to us, but to everyone, whether rich or poor, whether a Hindu or a Muslim, whether villagers or those who live in cities. The right to life in the Constitution is for all the people of the country.
Unlike the private sector, in the case the government does not earn any profit by providing us these facilities. What do you think government gets out of the polio or anti-malaria campaigns that it conducts? Money? No. Just the well-being of the people. Children, we need a lot of things to stay healthy. We need to get proper nutrition, medical services, and immunization services to stay healthy. Even if one of these things is missing, we will become a prey to illness, weakness, and malnutrition.
There are Anganwadi Kendras in Andhra Pradesh that provide nutrition to children below 5 years and give them soya granules, soya powder and chips. The state government has the last couple of years taken several new approaches to improve the access to quality health care. International organizations like the World Bank, European Commission and the Department for International Development or DFID support reform initiatives within the health sector in Andhra Pradesh.
Children, I hope you enjoyed this session. We'll meet again soon. Thank you.